Dr. Kanaram Jad from AIMS New Delhi. This webinar is about transmission of information of COVID testing and patients to local bodies. Here we will discuss why there is need for proper transmission of information of COVID-19. We will discuss who all should be notified, how to report the cases of COVID-19, what to do if a COVID patient is detected, how to report a death, and finally, how to use data for disease prevention. Why proper information is required for COVID-19? COVID-19 is a new disease and clinical presentation is variable. Robust data are needed from every district and state in a country to measure the public health impact of COVID-19 and to plan for timely health interventions to protect communities. We should know who are to be notified. All suspected, probable, and confirmed cases of COVID-19 should be notified. Suspected cases of COVID-19 are persons with influenza-like illness and severe acute respiratory illness who are under investigation for SARS-CoV-2 infection. Probable cases are suspect cases where SARS-CoV-2 testing is not available or inconclusive. Confirmed cases of COVID-19 are those who have laboratory confirmed SARS-CoV-2 infection. Each country may have country-specific definitions and these should be followed. Next is to whom to report. The cases should be reported to the government as per local rules and regulations of country. As per WHO, every country should establish COVID-19 care pathways at local, regional, and national levels. In India, cases are reported via district and state surveillance units to integrated disease surveillance program. The cases need to report on daily basis via online system or other system as established in the country. Here is an example of case report form from India. On left side, there is space for demographic details, case classifications that is confirmed or suspect, and clinical details. On right side, there is space for travel history, laboratory informations, clinical details, and public health response. All the laboratories are supposed to provide daily update, that is daily and cumulative, about the data of numbers of samples received, samples tested, samples under testing, and positive samples. Every country should have data tracking system for COVID-19 related data. Here is a screenshot of data tracking system from CDC for USA that is showing total cases, total deaths, and total cases in last 7 days. Here is a screenshot of COVID-19 data tracking system for India. It is also showing total cases, total deaths, total active cases as cumulative and daily basis. If a positive case is detected, first of all, shift the patient to dedicated COVID ward or COVID hospital for further management. Then inform to local response team in the hospital and start contact tracing. Each center should constitute rapid response teams and the teams should assist state to plan and implement containment strategy and surveillance. The team should assist in establishing system for sample transfer to nearest designated laboratory and review implementation of infection prevention and control practices in COVID-19 designated health facilities. What to do in contact tracing? Contact tracing should be done by a designated team as decided by local administration. As soon as the single event, that is identification of suspect or confirmed case, is detected, contact tracing must be aggressively implemented, preferably to be completed within 48 hours. Contacts of confirmed cases should be traced and monitored for at least 28 days after the last exposure to the case patient for evidence of COVID-19 symptoms as per case definition. Information about contacts can be obtained from patient, his or her family members, person at patient's workplace, or school associates, etc. A contact is a person that is involved in any of the following: providing direct care without proper personal protective equipment for COVID-19 patients, staying in the same close environment of a COVID-19 patient, including workplace, classroom, household, and gatherings, or traveling together in close proximity, that is within 1 meter, with a symptomatic person who later tested positive for COVID-19. If symptoms of COVID-19 appear within first 28 days following the contact, the individual should be considered a probable case and reported through reporting system. High-risk contact is who touch the body fluids of patient that include respiratory secretions, blood, vomit, saliva, urine, or feces, or who had direct physical contact with body of the patient, including physical examination without PP, or who touched or cleaned the linens, clothes, or dishes of patient, who lives in the same household as the patient, or anyone in the close proximity within 1 meter of confirmed case without precautions, or passengers in close proximity, that is within 1 meter of a conveyance with a symptomatic person who later tested positive for COVID-19 for more than 6 hours. Low risk contact is who share the same space, for example, same class for the school, worked in the same room or similar, and not having a high risk exposure of the confirmed case of COVID-19, or who travel in the same environment like bus, train, flight, any other mode of transit, but not having a high risk exposure. Death reporting is another aspect of transmission of information related to COVID. For reporting death, medical certificate of cause of death should be filled. All deaths should be investigated thoroughly for cause of death. All deaths should be reported to state authorities on daily basis. It is a typical medical certificate of cause of death containing part 1, that is immediate cause and antecedent cause, and part 2, that is other significant condition. Part 1 contains A, B, and C, and it should be filled as logical sequence from C to A. Means C leading to B and B leading to A. A is the final immediate cause and it denotes the mode of the death. Right column have time period between onset and death for a particular cause. These are ICD-10 codes provided by WHO for COVID. U07.1 is for confirmed COVID-19. U072 is for probable and suspected COVID-19. A death due to COVID-19 may not be attributed to another cause like cancer, except an obvious cause like trauma, as pre-existing conditions are likely to cause severe course of COVID-19. COVID-19 should be recorded on medical certificate as cause of death for all diseased persons, whether it has caused or it is assumed to have caused or contributed to death. Now we will discuss some examples. How to report COVID deaths as per this MCCD format. First example is of 40 years old male diagnosed with COVID-19. Here COVID-19 will be at C. It leads to the B, that is pneumonia, and it leads to A, that is ARDS. That was immediate cause of death. Code is written as U07.1 and duration is mentioned about 7, 3 and 2 days. This example is about 60 years male, father of COVID-19 patients. He was diabetic, presented with ILI and died. The COVID test was not available. Here C is the COVID-19 suspect with code U07.2. It leads to B, that is ILI, and B leads to A, that is ARDS. That was immediate cause. Diabetes will be in the part 2, that is other significant condition. Here is one more example. 50 years female who received chemo for breast cancer, admitted with breathlessness and developed shock and died. COVID was positive. Here C, B, A are COVID-19, pneumonia, and DIC respectively. Breast cancer will be under part 2, that is other significant condition. Data are used to know the incidence of the disease in various localities, age group affected, risk factors for severe disease and death. Based on disease incidence and prevalence, areas can be divided into different categories and area-specific preventive measures can be implemented. For example, in India, districts are divided into containment, red, orange, and green zone, and only essential activities are allowed in containment zones. To summarize, transmission of correct and complete information is an important step in managing an epidemic. We should follow country-specific guidelines for reporting disease and deaths. The available information should be used for further prevention and therapeutic options. Thank you.